The biggest thing right now is patients see the full arch implant restorations and they want the all-on X. And some people call it all-on 4. We don't place just 4 implants at the top. We're 6 or 7 implants because there's more stability. So we sit down with the patient and we look at them and say, see if they have any teeth that can be salvaged? And if we can save a tooth, then they're way down the path to a better bite. They can feel where they're at and when they're chewing. So we customize a treatment plan for the patient based on what they need and not just how fast we can do it. I also tell patients that all-on 4 is a very popular concept, but you as a patient, you want a restoration. You're not looking for implants. So you don't care if I place 4 implants, 5 implants, 6 or 7. So I need to place the amount of implants that will give you a solid restoration. Because if you have an all-on 4 and you lose 1 implant, now you have an all-on none. So you're not worried about the number of implants, you're worried about your restoration. How we treatment plan our all-on X implant, full arch implant cases, we do it as a global fee. So whatever you need, whether it's a bone graft, 6 implants, 7 implants, it's going to be the same fee. That way you're not being like you've walked into an auto shop. Now you got to pay me for this, and you got to pay me for that, and you got to pay me for this. So we try to tell you everything up front, and then that way if we get into the procedure and things change, you don't have to worry about, oh, I have to come up with more money out of my pocket. It's already covered. The advantage the patient has to come into dentistry by design is that we can do all the procedures except orthodontics. So if we are going to try to save teeth and the patient needs a root canal, we can do the root canal. If the patient needs a crown, we can do the crown. If the patient needs extractions, we can take care of that also. If the patient needs a bone graft, we can also do that. This saves the patient from being referred out to the root canal specialist, the oral surgeon, or the gum specialist. If you are the patient that is interested in the Hollywood smile or having a new bite, you want to raise your self-esteem and how your dental appearance is, your oral health, please give Melissa a call at Dentistry by Design and she'll set you up for a free consultation.